That sound is one of the most familiar and strangely satisfying sounds our bodies can make. We've all done it, flexing our knuckles, rolling our neck, or bending our knees just right to produce that distinct pop. For every person who finds it satisfying, there's someone nearby who cringes, often warning that you'll give yourself arthritis. But what is actually happening inside our joints when they crack? And is that old warning anything more than a myth? The joints that we typically crack, like our knuckles, neck, and spine, are called synovial joints. Imagine two bones meeting, but instead of grinding against each other, they're separated by a small capsule filled with a thick egg white-like liquid. This is synovial fluid, and it acts as our body's natural lubricant and shock absorber. Dissolved within this fluid are various gases, primarily nitrogen. When you stretch or bend a joint, you pull the bones apart. This increases the volume within the joint capsule, which in turn decreases the pressure on the synovial fluid. According to a fundamental principle of physics known as Henry's law, this drop in pressure causes the dissolved gases to rapidly come out of solution and form a tiny bubble or cavity. The cracking sound you hear is not the formation of the bubble, but its immediate collapse. It's a process called cavitation. Think of it like opening a can of soda. The psst sound is gas escaping the liquid due to a sudden pressure change. In your joint, it's a similar idea, but it happens in a split second, creating a sharp popping sound. This also explains why you can't immediately crack the same knuckle again. You have to wait about 20 minutes for the gases to redissolve back into the synovial fluid before you can create another bubble. Now, not all joint sounds are from cavitation. Sometimes you might hear a snapping sound from a tendon or ligament moving over a bony protrusion. This is common in the knees or ankles when you stand up. It's like a rubber band being plucked and snapping back into place. These sounds are also generally harmless. So we come to the big question: is any of this harmful? Specifically, does cracking your knuckles lead to arthritis? The overwhelming scientific consensus is a clear no. One of the most famous studies on this topic was conducted by Dr. Donald Unger. For over 60 years, he cracked the knuckles on his left hand at least twice a day, while leaving his right hand as a control. He reported his findings in 2009. After a lifetime of dedicated cracking, there was no difference in the amount of arthritis between his two hands. While this is just one man's experiment, larger, more formal studies have confirmed his findings. There is simply no credible evidence linking habitual knuckle cracking to arthritis. The only time you should be concerned is if the popping sound is accompanied by pain, swelling, or a limited range of motion. If you experience pain when a joint pops, especially after an injury, it could signal an underlying issue like a torn ligament or damaged cartilage. In that case, it's always best to consult a doctor. But for the vast majority of us, that daily ritual of cracking our knuckles, neck, or back is nothing more than a harmless release of gas. It's a normal, natural feature of having healthy, lubricated joints. So go ahead and enjoy that satisfying pop. It's not a sign of damage, but simply the sound of your body's elegant internal mechanics at work. This has been the Daily Dose from Curious Growth. Join us again tomorrow as we continue to explore the fascinating world around us and within us. Until then, stay curious.